Tinnitus can have various underlying causes and is often associated with other medical conditions or factors. Here are 12 possibilities and issues commonly linked to tinnitus. 1. Noise-induced hearing loss. Exposure to loud noises, either over a short period, e.g. attending concerts, or long-term, for example, working in noisy environments, can lead to both tinnitus and noise-induced hearing loss. 2. Age-related hearing loss. Age-related hearing loss, known as presbycusis, is a common cause of tinnitus in older individuals. As we age, the structures in the inner ear can deteriorate, leading to both hearing loss and tinnitus. 3. Earwax blockage. Excessive earwax can block the ear canal, causing tinnitus. Removing the earwax usually resolves the issue. 4. Ear infections. Infections in the ear, such as otitis media or otitis externa, can lead to tinnitus. Treating the infection usually resolves the tinnitus as well. 5. Medication side effects. Certain medications, including some antibiotics, antidepressants, and non-steroidal anti-inflammatory drugs, NSAIDs, may cause or worsen tinnitus as a side effect. 6. Cardiovascular issues. Conditions like high blood pressure, atherosclerosis, or turbulent blood flow can lead to pulsatile tinnitus, a type of tinnitus where the sound is synchronized with the heartbeat. 7. Temporomandibular joint, TMJ. Disorders. Problems with the jaw joint, known as TMJ disorders, can sometimes lead to tinnitus. 8. Meniere's disease. This inner ear disorder can cause tinnitus, along with vertigo and fluctuating hearing loss. 9. Head and neck injuries. Trauma to the head or neck can damage the auditory system and result in tinnitus. 10. Systemic health conditions. Conditions such as thyroid disorders, diabetes, and autoimmune diseases may be associated with tinnitus. 11. Acoustic neuroma. A rare benign tumor on the vestibulocochlear nerve can lead to tinnitus and other hearing-related issues. 12. Psychological factors. Stress, anxiety, and depression can exacerbate tinnitus. These psychological factors may not cause tinnitus directly, but can make the perception of tinnitus more distressing. It's essential to note that tinnitus is often a symptom rather than a standalone condition. If you experience persistent tinnitus, it's crucial to consult with a healthcare professional or audiologist to identify the underlying cause and determine the most appropriate treatment or management approach. Click the link below for more info.